Do you have to be awake for a C-section? Can you decide whether you are awake or asleep? In my post about panic attacks during C-section, a few people asked me a version of this question. No, you don't have to be awake, and yes, of course, you can decide. Most of the time, we do recommend being awake with a spinal or an epidural. Most of the time, patients want to be awake. Most of the time, patients do just fine being awake. But I know there are people who do not want to be awake, and your preference does matter. A patient's refusal to get a spinal or epidural is a contraindication to a spinal epidural, and in that case, our only option to provide anesthesia is with general anesthesia. Both choices are considered to be safe, and the anesthesia-related risks for both options are low. The reason we recommend being awake with a spinal or epidural, aside from that most, but certainly not all moms want to be awake, is because on a population level, being awake is associated with some improved outcomes and risk reduction. For example, lower risk of blood clots, postpartum depression, surgical site infections, and blood loss. However, when we're talking about risks, they must always be individualized to the person. So if you're a patient making these choices, you have to be aware of your own personal risk factors, which you may or may not have for general anesthesia. And also just make sure you understand other aspects of your care, which may be affected by having general anesthesia instead of a spinal or epidural. For example, understanding what your post-op pain plan will be, understanding what the involvement of a support person might look like, or even something like where you'll recover from surgery. Even if you're not choosing general anesthesia, everyone should know that it's always our backup option in the case of certain emergencies, if there are other contraindications to a spinal or epidural, or if a spinal or epidural fails to work.